Thank you for joining me on TMI Tuesday, the 24th day of March. And as you know, the global challenge here is the coronavirus outbreak. And the world is battling hard to ensure that this outbreak is abated. But how are we really focusing on preparations to abate the impact we're having here in Nigeria? As at yesterday, 11 p.m., the Minister of Health, Osage Hanire, did say that we have cases of 40, and that means it's increasing by the day. And there's need for us to really ensure we follow the guidelines on prevention of this coronavirus disease. And discussing today with me, I have the presence of the senior lecturer and also a consultant public health and medicine community, University of Benin Teaching Hospital, Dr. Andrew Obi. Thanks for coming, Andrew.
Thank you very much. Good morning.
Yeah, well, we're looking at this whole challenge. The world is really trembling over this disease. But for those who really are thinking, how is the behavioral pattern of this disease?
Well, early this month, I think precisely on the 11th of March, it was declared a global pandemic, and is a highly contagious disease, and that has the potential to spread fast. Okay, and it's a source of worry to everybody. Okay. But when you talk about bring on the issue about behavioral pattern, that is where the problem is, you know, in terms of how, as an individual and as a community, we are responding to the disease and to preventive measures. Most times, people are not used to some of the preventive measures that, in the course of this program, we're going to talk about.
Okay.
But in the long run, if we're able to imbibe and try as much as possible to put them to practice, to a large extent, to help curtail the spread.
Okay, can you describe vividly the symptoms that could be generated in this, those who contract the virus?
Now, it's important to note that some of the symptoms that I'm going to mention now are actually non-specific, and so that we don't have a situation where people will begin to panic, and that is bringing into context again the behavioral aspect of the disease. So having said that, now most persons who present with the disease now known as COVID-19 present with features of common cold. Okay, sometimes they could present with sore throat, running nose, in some instances they could come down with fever. Okay, they could have what we call difficulty in breathing, and in very, very severe circumstances, they have what we call a pneumonia, okay, which could progressively affect the lung and compromise your ability to take in oxygen, and to a large extent, if it's not well managed, it can lead to death. So most often, these are the common presentation. And also, persons could have this sense of unwell, you know, general feel, what we call in the medical parlance, malaise. You have this general feeling that you're not well, all is not right, you know, you can't really figure it out, you know. You have this headache, this feeling of heaviness in your head, you know. So these are some of the common presentations. Okay. And if you listen very well, you find that these are common presentations that people who have common cold, what we call catarrh, also present with. So having said that, it therefore means that it's not all such presentation that is COVID-19. And so that's where the medical experts, and that's why this entire session is also very, very important, so that people can be sensitized, so that we don't begin to have a situation where you have undue panic. Because the problem with panic is that it could cause more problems than actually the disease condition that we are trying to contain.
You really nailed it, because looking at the symptoms associated, also related symptoms with other ailments. But maybe the distinguishing factor there could be the seizure of breath or breathing, like you said.
No, pneumonias, any pneumonia could have
Could also have that.
So the main thing here is diagnosis. And that's where the health facilities come in. The health facility and the system component comes in. And in the entire process for containing this pandemic, the laboratory component is very, very critical, because that is what is going to tell you whether this is actually COVID-19 or something else.
Okay.
And so that's where diagnosis is important. But having said that, it therefore means that when persons present with have such presentations, okay, and they have had a recent contact with someone who might have traveled into the country from any history of travel now. You know, when the whole thing started, everybody was China, China, China. Well, now you agree with me that it's not only China.
It can be even our neighboring country.
It can be our neighboring country. So once you have had a recent history of travel into the country or into the states,
okay,
you know, and you need to embark on what we call self-isolation, because the process itself could have exposed you to persons who might not be symptomatic, who are harboring the virus, because the plane environment is also a risky environment. Being on a flight is a risky environment. So coming in through that channel, then we should be able to self-isolate ourselves and monitor ourselves for about 14 days to see whether we're going to come down with any of these symptoms. And if we do, like I told you before the program started, the numbers that you should display on the screen, the Nigeria Center for Disease Control, the Edo State Incident Management thing, you know, numbers, then you should be able to contact them and tell them that this is what you're having, these are the symptoms, you just returned from a trip, what do you do? Definitely you'll be advised on where to seek help and how you are supposed to get laboratory investigations done on you to confirm whether it's just something else or COVID-19. Okay,
the common thing that comes to mind for those who are maybe having these symptoms, like you said, self-isolation.
Isolation, yes.
Yeah, but again, if you say self-isolation, would they not also be interacting with their family members? Would there not be a risk? Or
no,
how should they self-isolate?
No, ideally, if it's possible, limits, you know, but you know, you need to still look at the logistics of all this. But you see, we are in a situation where people need to make uncommon sacrifice, okay? Because the more you move around, the more you expose people to risk. Ideally, you know, you should be on your own. On your own?
Yes, even your family members, relatives shouldn't have access to you.
Ideally, you should be on your own. Ideally, if you have any history, you know anybody within your neighborhood who just returned from a trip, you're supposed to call these numbers that I talked to you about on the screen, and just inform them that this person just came in. You're not reporting them. You're only trying to make sure that in a situation where there is a confirmed situation of COVID-19 in that particular person, you already have the details. Okay? So if you don't have information, who are you going to contact trace?
Okay.
And so, which is also a very, very vital aspect in containing this pandemic. But you know, most times we are talking about the hand washing component, which is critical. That has the level of the individual. Now, social distancing to protect us from exposure. That is also very, very critical. Okay, contact tracing is also very, very important. It could be through the manifest from the airlines or in terms of those people involved in land transport or whatever channels of entry into the country, whether you're using sea borders or land borders or you're using the air route. The manifest should contain valuable information that should be well managed so that we can reach out to persons who have embarked on recent trip into the country and follow them up. You want to know their location, you want to know their phone contact, you want to know, have an idea, how many people have you been able to come in contact with? Most times they'll tell you that it's their immediate family. You get the details of those persons. So that in a situation where some of them, not all of them, would present with symptoms suggestive of COVID-19 and they are diagnosed to be positive, you already have information to deal with. You know, in a situation where somebody is tested positive and you can't trace anybody, that means a lot of people are exposed. And so that's why I really appreciate the effort of the federal government and the Edo State government coming out with press statements limiting social gathering and trying to enforce some form of social distance.
Okay. But outside that, yes, there are mind-boggling questions, like the one that comes to the front burner is, what is the government doing in terms of providing facilities? Now, can you say that the isolation centers we have presently can contain this challenge? And again, I was going through reports where it said, in Nigeria, we have less than 500 ventilators.
So, you see, so that's to tell you that government needs to do more, okay? And I believe that our government is very sensitive to these recent happenings. And I believe that the Presidential Task Force, and even at the state level, they have their technical team. They are doing everything possible to make sure that if they are having isolation centers, those isolation centers are well equipped with manpower, with equipment to ensure that we are able to tackle this thing. You must give it to Nigerians, especially the health system, considering the various challenges that we are facing.
Okay.
The Nigerian medics or healthcare professionals, considering the environmental situation that we are faced with, we are still doing a lot,
okay,
to help handle a lot of issues. And now I believe strongly that the system is being strengthened continually to be able to tackle these things as the need arises.
Okay, you are a consultant of public health and community medicine, University of Benin Teaching Hospital. What is the size of the beds available in the isolation center?
I want to really, on this juncture, I want to appreciate the Chief Medical Director of the University of Benin Teaching Hospital, Professor Darlington Obaseki. He's a man that is strong-willed and determined to make sure that the system works. And I want to tell you that he has been doing a lot in the past weeks. Since the whole issue of the COVID-19 issue came up in December, he has been assembling his team. They have been doing a lot to make sure that the system is ready to be able to handle this. And there's something that you need to understand. The capacity for isolation is an ongoing process. So you can't say currently we have finalized measures to ensure that if we have such a presentation, we have the capacity to manage it within our establishment.
Yes.
And we are also working strongly with the state government, state government to ensure that there is synergy. There's something that you need to understand about when you have a pandemic. Pandemic is not a one-man show. Pandemic is about governance and coordination. So as many as can come into the process, the better. The government, I believe they are doing a lot. At the level of the teaching hospital, the management of the University of Benin Teaching is doing a lot in terms of capacity building, in terms of equipment. In
case we have any issue as a result to increase number of cases.
And I also believe that there's a high-level coordination of other health facilities. So it's not just about UBTH, it's not just about the state government. We also need to also see how we can collaborate with the private sector, because we also know that there are private health facilities within the state. And so by the time everybody sees it as our problem, not just the state government or the federal government or a public health facility, the private sector comes in, you find that we'll be better positioned to be able to tackle this issue.
Okay, thank you. In case you're just joining me, it's TMI Tuesday, and I've been having a chat with Dr. Andrew Obi, who is a senior lecturer at University of Benin and also consultant public health and community medicine, University of Benin Teaching Hospital. Well, we basically expecting the presence of the Commissioner of Health at those State, Dr. Patrick Okundia, but for unforeseen circumstances, he's unable to really be here to answer some questions in respect of these cases we are having. But well, let's progress. Let's look at the treatment of this virus or this ailment. Just some days back, it was said by the NAFDAC DG that chloroquine is approved for clinical trials.
Yes.
What's the development so far in terms of the performance of the chloroquine?
There's a lot of evidence outside the country that suggests that chloroquine has, in a combination with other medications, which
like azithromycin.
Very well.
Like I heard.
Yes, azithromycin has a strong potential to improve the speed of conversion from seropositivities to seronegative, meaning by implication, people who are positive for COVID-19 after some few days of these combinations under strict medical guidance. I think this is very, very important because just last week, we started having reported cases in Lagos of people coming down with chloroquine poisoning. So, and that's why, you know, in mediums like this, we have to clearly state it that this is under strict medical guidance, okay? So that you don't just go out there and start purchasing these medications and thinking that you have COVID and you begin to consume them. You may actually be doing more harm than good to yourselves. And so it's actually under strict medical guidance, okay? And that's why it's a clinical trial that you rightly asserted.
Okay.
Now, so this is also very, very important to our population because a lot of people are listening, and once they hear, oh, it's chloroquine, everybody begins to scramble and start getting chloroquine and azithromycin. We should also be careful about the potential for poisoning. And so that's why it must be regulated. It must be in a recognized center that has the capacity in terms of manpower, in terms of many other things, resources to be able to handle the COVID-19 issue. So it's not just for everybody to just go ahead and consume. So having said that, there are supporting evidence globally, you know, from WHO, from countries that have used it, CDC in the United States of America, that says that there's strong potential for these two combinations to help address COVID-19. But there's still a lot involved in case management, and it's not something that you discuss in this kind of medium. Management, once people have symptoms suggestive of COVID-19, which I've mentioned earlier, and you have had history, a recent history of travel, a recent history of contact with a confirmed case, a recent history of visit to an establishment that is managing a confirmed case of COVID-19, the first thing you do is to self-isolate or self-quarantine for 14 days. And if you notice that you are beginning to develop such symptoms, you call the numbers that are going to be displayed on the screen. And you'll be advised where to go to seek medical care and get confirmation. Okay, that is very, very critical so that people don't begin to assess treatment without being sure of what is actually wrong with them. I think that is important to note at this juncture.
There's this fear. Like I was in one of the hospitals yesterday, and I got scared because there were suspected cases of some persons who traveled from overseas that came into the clinic. Now, what exactly could be, or how can the public really maintain this challenge where maybe they visit hospitals? Some do say that, well, that could be a very wrong place to be. What do you think about that?
There are so many reasons why people visit the hospital, okay? It's just like embarking on a flight. An aeroplane is a high-risk zone, okay? The hospital, any hospital, you know, now is considered also a high-risk zone. And I'm very sure, just like in my establishment, there are modalities that we are putting in place to ensure that if you don't need to be in the hospital or visit the hospital, don't go there.
Oh, yes.
Don't go there. A hospital is not a social club. You heard someone is sick and the entire village community
move down
move down.
Pay sympathy or condolence.
Not at this time.
Not at this time.
Not at this time, okay? We must limit. You can call in to say, how are you, how are you doing, to express, you know, concern for the person that is sick and hospitalized. It's not the time to everybody troops in there. You're exposing yourself, especially persons who are of young age, children, and the elderly. Even adults, anybody visiting the hospital for no just reason is actually exposing him or herself to the risk.
Okay, but how do you, as health workers, how do you cope with this
No, health workers, you know, if we don't, we need to be there. You can imagine a situation where we close down the hospitals. So what are you trying to infer? You are trying to tell people that there's no way out. Okay? And but it's something that we have as individuals, is a calling. To be a medic or a healthcare worker is a calling. And more importantly, at times like this, we are in the front line. It's like a war zone. Okay? The current situation is a war front. And you have persons who are at the front of the entire thing. And that's where you have the healthcare workers. But having said that, health workers are also taking necessary precautionary measures to minimize exposure. I'll give you an instance. Now, one of the measures, you could reduce the number of pest consultations to strictly those people coming in on emergencies. On emergencies. Some health facilities have done that. You could also give longer appointments on medication in terms of persons who are coming to the hospital to get refills for their medications. Instead of giving a 1 month medication, you could make it 2 months. By so doing, you are limiting the number of persons visiting the hospital at every point in time. Okay? So that's also very important. The hospital is also, especially the University of Benin Teaching Hospital, are putting a lot of measures on IPC, infection prevention and control, like hand washing points. We are already enforcing matters bordering on social distancing, the issues of face masks during consultation. Even for patients? Yes. Patients, and especially patients who have respiratory symptoms. Yes, symptoms. We'll give them face masks. That, in a way, helps trap the droplets and reduces exposure. The frontline healthcare workers are also masked. They use their face masks to limit and protect them, because if the health workforce is not protected, how can the citizenry be protected when they have need to visit the health facility? So you can agree, it's a system thing. And everybody must see that they play their own parts. As individuals, as community, as the health system, as government. We play our roles to ensure that what needs to be done is done. The resources that needs to be released to ensure that the right equipment, the right drugs, the right laboratory test kits are purchased to help handle and contain this epidemic. So it's an all thing. Everybody is involved. There is this mindset of many Nigerians that being that we have poor infrastructures as compared to the developed polities, that when they have these symptoms and they present these symptoms, they could be quarantined to a point where they will be abandoned. How do you encourage them? The truth of the matter is this. We have looked at the challenges, and you need to understand, nobody knows your house or home better than you do, And looking at that situation, that's why even globally, there's no system, even in very advanced countries, that will be able to quarantine everybody that travels and all that. And that's why the concept of social distancing, the concept of self-isolation and self-quarantine comes in, so that everybody must be patriotic now. You must do, your own part to ensure. Recently, someone just told me that someone returned from a trip, and that person knew that he was coming, and his families were coming from a high risk. They self-isolated themselves. At some point, they even reached out to the hospital to find out, what can we do? So that shows that that person is informed. That person has also decided to take necessary steps to limit spread. We are not saying that every person that is quarantined or self-isolated is infected. But we are actually saying that if those persons do the needful in terms of withdrawal from a larger group of people, from a larger population, the spread will be minimized. You do yourself a lot of good and the society too. Society. Bearing in mind the challenges that you just mentioned. So if you have a system that the government is trying to do its best to make sure that things work, and sometimes looking at the effort, you find out that there are still a lot that needs to be done, and everybody should know that they also owe themselves and the
Okay.
general community.
Well, we don't have much time. We're pressed for time. But quickly, let me ask you this question because it's also mind-boggling. As it bothers me, I believe it bothers a lot of persons. Like we make use of the hand sanitizers intermittently and also do hand washing. But sometimes, immediately you make use of the hand sanitizer, you have to touch the handle of a door or knob of a door.
Yes.
Would that be safe?
Well, you know, you see, one of the fastest routes of transmission or routes of transmission of this virus is through contact with surfaces and contaminated objects, okay, and even through droplets. And now there are newer things that are emerging, postulating possible air route of transmission. Because this viral thing is a new thing. We're understudying, getting more information by the day. Now, having said that, the critical thing is that you continue decontamination. If you are using hand sanitizer, fine.
If you use it now and then you touch the handle of the door, use it again.
Use it again. And you know, if you your phones, your key, as you move around, you know, you could spray your hand sanitizer on them and use your wipes, to clean it up. You know, that minimizes the ability of that particular object to be a medium. And another important thing that we should note is that if you are going into a high-risk zone, there are a lot of things that you shouldn't go with you. You shouldn't come in there with your laptop. You may not come in there with your phones. You may not come in there with certain things that could have
deposits on them.
Yes, on them. So you go in there with only the things